even with corpsmen that come through, like, okay, great, you've worked in an ER for most of your career and you've seen trauma, but that was more in a controlled setting, right? You have your providers, you have other docs with you, you have an entire hospital network there to support you. If we remove all of that, and you are in essentially like a battlefield setting, you're not gonna have any of that. And you can't just go from expecting to work in a setting like that and then being placed on the battlefield and thinking you're going to perform the same, because you won't. We try to mimic the best to our ability of what it would be like in a real world situation where it is chaos, it's dark, maybe it's super bright, maybe you can't hear anything, maybe there's loud sounds, maybe you lost your team members because the terrain is confusing, or whatever that might be. This is how it's going to be if something was to happen or a disaster was to happen. Like, how can you use your resources, your team members, and whatever you have around you to help this patient that you have? Because at the end of the day, you have to get your casualty out of there. However you get them out of there, that's up to you, and that's a judgment call you have to make, right? That's what we talked about with life or death decision making that you're going to have to do and live with.